In today's society, people tend to believe that their gastrointestinal tract, which is the stomach, intestines, and digestive organs, isn't working great. And it's hard to say whether people do have poor intestinal health, and sometimes it's just their opinion that may be due to misconceptions. So it might be useful to learn some basics about gastrointestinal health.
What are some important dietary habits to be aware of?
Well, for starters, regular meals are important, and during your meals, chew your food thoroughly and do not consume an excessive amount. Avoid rigorous exercise right after meals, and also important to avoid lying down right after a meal, and you could also consider taking walks. And also, do not consume a meal within 3 to 4 hours of bedtime. And it's important to just overall avoid weight gain.
Which foods are bad for the gastrointestinal tract?
Well, avoid excessively oily or fatty foods, and it's important to consume more vegetables and fruit, which contains a large amount of fiber. And since fiber cannot be absorbed, it helps with having regular bowel movements. And don't drink excessive amounts of alcohol. Drinking excessively not only damages the liver, but also leads to gastrointestinal bleeds, reflux disease, and so on. And some foods are thought to irritate the gastrointestinal tract, and these include carbonated soft drinks, caffeine, spicy foods, sour fruits, onions, tomatoes, oily foods, deep fried foods, chocolates, and mint. However, everyone's different, and some people may find certain foods irritating, while others are not bothered by it. So pay attention to which foods irritate your gastrointestinal tract.
What is gastroesophageal reflux disease, or GERD?
So GERD is basically when the stomach contents enter the esophagus, causing discomfort. It's one of the most commonly seen gastrointestinal diseases. It most commonly affects those between the ages of 30 and 60, with females being at a slightly higher risk.
How is GERD diagnosed?
It has to be diagnosed by a physician, and the most common symptom is a burning sensation in the chest, as if there's a fire burning behind the sternum, leading to the sensation that the heart is in pain. Thus, it has the common term of heartburn. The sensation usually extends up from the chest into the neck, and another common symptom may be the sensation that the stomach contents have flowed back up into the throat or even the mouth. So remember to see your physician if you have gastrointestinal problems.
How is GERD treated?
The main treatment is using medications, and there's various types of medications, so please consult your physician. Other than medications, remember to follow the recommendations mentioned before for maintaining a healthy gastrointestinal tract. If you're overweight, losing weight may actually help with this disease.
Are there nutritional supplements for GERD?
According to evidence-based medicine standards, there are no nutritional supplements for GERD. Effective products are categorized as medications, not supplements. The most basic medications are antacids, and even though they don't require a prescription, it's still a medication.
What are some other common gastrointestinal problems?
Well, in Taiwan's population, constipation is one of the most common gastrointestinal problems. And among Taiwanese females, up to 24% will complain of constipation. So risk factors there are being female and having an increased age.
Why do so many people have constipation?
Well, everyone has their own definition of constipation. So some people believe that not having a bowel movement every day is constipation. However, everyone's body is different, and for some people, normal is a bowel movement 3 times per day, while for other people it may be 1 bowel movement every 2 days. These frequencies are normal. What's more important is the change in bowel movement frequency or having discomfort with bowel movements, which you should pay more attention to.
Why does constipation occur?
Even though constipation can be a symptom of some diseases, the majority of the time it's due to lifestyle and dietary habits. So diets lacking fiber and fluids, lacking exercise, or not allowing for a bowel movement when the urge is there can all lead to constipation.
What are the risks of chronic constipation?
Constipation mainly leads to various discomforts, such as abdominal bloating and pain. However, research found an association between chronic constipation and colorectal cancer. So people with chronic constipation have 4.4 times the risk for colorectal cancer. However, this is just an association, not necessarily causation.
How is chronic constipation treated?
Well, other diseases must be ruled out first, so it's important to see a physician, especially if there's a sudden change in bowel movements, pain, vomiting, and so on. If it's not due to any other disease, then the treatment starts with changing lifestyle and dietary habits.
Are there nutritional supplements for constipation?
There are countless products that claim to help bowel movements. Many of them are actually medications, not supplements. So evidence-based medicine has found that psyllium husk helps people who have occasional constipation. But please remember, if there's no discomfort, even one bowel movement every 2 days is still considered normal. If you're not constipated, why force your bowels to excrete their contents? Taking medications to force more bowel movements isn't necessarily beneficial for the body. The intestines need time to absorb nutrients.
So what's the best way to preserve gastrointestinal health?
The best method is still to maintain a healthy lifestyle, and as mentioned before, it's not just eating healthy, but also not smoking, not drinking excessively, exercising regularly, and avoiding being overweight.